Hello, my name is Wendy Olsen, and I am so sorry that I did not get to present to you on the day of the Hope and Help Symposium. Um, we were experiencing some technical difficulties that weren't able to be resolved, and in order to move forward with the symposium as scheduled, we decided to go ahead and offer this particular presentation in a recorded format. So today I am happy that we are able to do that for you all. I will be presenting on AAC solutions for individuals living with ALS. And I am going to move forward with disclosures, the fun stuff. I have no non-financial relationships to disclose. I am a paid consultant for the ALS Association, the Florida Chapter. I'm a full-time employee of the University of Florida, and I receive funding from the National Institutes of Health. And these particular three items highlighted in red are the grant funding mechanisms that I receive monies from. So when asked to do this presentation, it was a short, limited presentation, 20 minutes. So I promise I will stick to that format. But I wanted to hit up on a few things that I know that I get asked a lot as a clinician and when I'm in clinic. Some of them, especially patients new or families who are new to the clinic, they often ask, what is a speech language pathologist or an SLP? Sometimes the language is intertwined, and what do we do? The next is, what is the difference between augmentative and alternative communication, or AAC, and assistive technology, also referred to as AT? And what is the ALS Association's equipment loan program? So that's pretty specific to the chapter itself. And what's in it? What's in the ELP? And kind of generic overall, once people are kind of aware of these things, they ask, is there anything I can do about my speech right now? And I figured, there's a lot of questions that I get asked, but these are pretty much some of the top ones. And these are sometimes questions that I get forwarded from regional program managers and people who are concerned about their loved ones. So diving right into it, a speech language pathologist is a healthcare professional who diagnoses and treats communication and swallowing disorders. So at your clinic, you might have a speech language pathologist that treats you for any type of speech disturbances, or they might be evaluating your swallow, trying to make sure you're eating and drinking okay, if you're able to protect your airway okay, if you have a really nice productive cough, if it sounds good, asking you if you're choking at meal times, making sure that meal times aren't really getting extended too long and that you're eating and drinking okay. They'll ask you or your loved one if you've noticed any changes in your speech, if it feels like when you talk there might be marbles in your mouth, if anybody is having difficulty understanding you at home or in the community. And these individuals are essential for a swallow and AAC evaluation. I put an asterisk after the AAC evaluation because AAC evaluation encompasses a lot of things. I think when people hear AAC evaluation, they think, oh, the big computers that talk for you. And they wouldn't be wrong in that, but there's so many other things that an AAC evaluation is. It could be getting baseline measures to see what normal speech is. Maybe your speech isn't being affected, and maybe it won't be, we don't know, but because we do know 85% of folks affected by ALS will need to augment, meaning change the way they communicate in some way, but it doesn't necessarily mean everybody will need a computer that speaks for them. An AAC evaluation could be using a voice amplifier. It could be using low-tech communication boards. It could be using lots of different tools to help you communicate effectively with your healthcare team, your aides that come in. It could be effectively communicating with those in your home. It could be doing a lot of things. You might get a speech generating device, and an SLP will also be able to provide training through that AAC evaluation. And in clinic, we can also kind of do a real quick troubleshoot, or we can also provide numbers for the vendors maybe get on the phone with them and see what's going on, see if we can increase dwell time to access certain things in the speech device, modify some strategies for you or your family members to try and just effectively communicate a little bit more. Maybe sometimes play peacekeeper with, I'm not really understanding what they're saying, but I know they really want to use their speech, and that's okay. We strongly encourage you to communicate whichever way is best for you, but maybe kind of playing, peacekeeper as far as like, let's set some ground rules and see if we can improve communication a little bit. So that kind of leads to, what is the term AAC? Well, it's augmentative and alternative communication. And then people kind of look at me like deer in headlights. What does that mean? So ASHA, the American Speech, Language, and Hearing Association, defines it as multiple ways in which we communicate thoughts, feelings, ideas, because we need to either temporarily or permanently change the way that we talk due to some type of challenge or disability. And it can be due to severe expressive communication disorders. It could be due to surgery. It could be due to neurodegenerative disease. It can be due to a lot of things. And this is typically experienced across the lifespan. So you'll have children, you'll have adults. The difference is, dependent upon where you are in your life, will be how we come in and try to assist you with those needs. So even people who can effectively communicate actually use AAC every single day. So AAC can be lots of different things. And I'm going to get into that in the next slide. But I use AAC every day. You use AAC every day. It's just, people don't think about it that way until we kind of define the terms a little bit better. So I'm super excited to show you what I mean by that. So there's 3 types of AAC. There's no tech AAC. So that's gestures and sign language. Then you have low to mid tech AAC, which can be communication boards, megabees, voice amplifiers. Then you have high tech AAC. So that's that big speech generating device, laptops, computers. It can be even, some people argue between low and mid and high is, text to speech apps on those laptops and computers. What really defines low to mid tech AAC to high tech AAC is the ability to perform different functions. So how much output can I have, and how much storing ability do I have? So how much can I store on that device to effectively communicate the output? So communication boards and megabees, there's not a lot that you can store on there. So it requires a lot of effort on the communication partner and the communicator's part. With high-tech AAC, it's a little bit more independent, but not completely independent. And I think that's a big misnomer. People see these big speech generating devices and they're like, yeah, I can be completely independent on this, but that's not really the case. Even with those big speech generating devices, you're still going to need some assistance from your support team, your caregivers, to really help you effectively communicate. And that's okay, because if we're communicating, we need somebody to listen to our message. So you're going to need that. And that's also another role of the SLP, like I mentioned previously, is the training. And no tech is kind of what we use every day, right? We have gestures and sign language. And sometimes people will ask me, is it prudent or worthwhile to learn sign language if my voice is gone, but I can still move my hands? And really, I leave that up to you. But I will say that you're going to spend a lot of time learning a new language. And it might be also prudent to learn different strategies, and knowing that, you have to make these crisp, clear hand movements. And that might be something to consider when you're making that choice. So that brings us to the question, what is AT, or assistive technology? So it's any item or system or product that is used to help you improve your functional capability if you're facing functional challenges. So people use AT every day. So this can be seen in video surveillance cameras. This can be seen in alarms. This can be seen in, digital calendars on your phone, voice reminders on your phone. It can be the wireless earbuds that you have for watching TV on your phone or watching TV in general. Some of my favorites are switches because they can help us access technology with the different abilities that we do have. I like to look at things that we do have instead of trying to utilize things that we might be having difficulty with. And I also like things that kind of help us interact with our environment. So a big AT device that a lot of people have in their home is Alexa. It's a product and you can use it to access different things in your home. And Alexa, the cool thing about it is if you happen to be having a little difficulty with your speech, Alexa has now been programmed to help you use text-to-speech voices. So the text-to-speech apps on your phone, or even the voices that come out of the speech generating devices now respond to Alexa, and you can program it that way, which is really nice. So when we're talking about AAC and AT, we kind of use them together a lot of the time. And I think that's really nicely represented in this Venn diagram. I'm trying to not, if you're not a math person or a graph person, I apologize, but I think this really kind of demonstrates the way that we use these two principles together, and the SLP's role and the ATP's role. So ATP is a person who's an assistive technology professional, and they really kind of know how to make magic work with these different devices that can be paired with alternative and augmentative communication pieces that we have to help people with communication disorders access that technology. So when you have the communication disorders therapy, you need a licensed medical professional who is a speech language pathology to help not only diagnose, but to treat that. But if you also plan to use AAC, that also has to be written and evaluated by a speech language pathologist. They're also going to have to train to help overcome that communication disorder. But with assistive technology, they can use collaborative sources like an ATP or resources out in the community, like a university engineering team, ATPs, the FAST Center at TGH or the FAST Center at UCF, University of Central Florida. There's a FAST Center and Tallahassee. These are all free grants within the community where they have assistive technology that patients can try for free and use it with their augmentative alternative communication. And SLPs help arrange that. So SLPs are really powerful members on your community medical team. So when these pieces are used in tandem, you can kind of look at it like these. You could want to consider the tools that you want to use to help you effectively communicate. So you think about the AAC and then you think about the AT. What if this person that I'm thinking about needs to not only use their hand, but maybe they're experiencing a little bit of weakness in their hand and they're concerned that their hand might get tired or it may not work for them. Maybe I need to use a different body part to help them access the technology, like their head or their foot. Well, I need to start thinking about a different tool that will help them use their head or their foot. And that's where I have the AAC and the AT come together. Then once I have my tools together, I need to see how they work. So I want to actually implement those things. Once I implement those things, I see how it meets the needs of the patient. If it meets the needs well, then we can use this. We can use this together to help that person effectively communicate. But if it's not helping them, then we need to go back and look at the AT tools again and see if there's something different we can use. Maybe that person isn't really doing well with their foot. Maybe their foot isn't giving them the full range of motion they need to use it. Maybe we need to think about the head, or maybe we need to think about the eyes. So here are some examples. So I know a lot of people are familiar with the eyes, but here on the right-hand side, this woman is using what's called a scanning method. So if you look at the top left corner of her screen, you can see that the box is highlighted in red. And if you look at her hand, you'll see that she has, in her right hand specifically, she has like what looks to be a little blue button. That cord is actually plugged into this speech generating device. Now the scanning method will literally go through each option independently in a timed phase. So every second it will highlight a new option for her. When the option, or when the box highlights the option that she wants, she can select it with the blue button. When she selects it, that option will open for her. So it's independent of her use other than it's a scanning method, but she selects and accesses with a button switch. And these can actually be varied in pressure. So you can either use a lot of pressure or a little bit of pressure. And it can be the difference between a light switch or a big red button. So she's actually holding a light switch. If you look on the table, that's the big red button. It requires a little bit more pressure. So it just depends on the person's needs and what they want to use. Currently, she's using a table stand and she's using a PRC Accent 1400 is the speech generating device. If you look to the young woman on the right, she is using a sip and puff switch with an iPad and a timing scanning method. So she's also using a stand, and she's also using a universal clamp mount with the sip and puff switch. So the clamp holds on to the sip and puff. So she is actually sipping, and you can tell she's sipping because she's closed her lips over the puff or the tube, and she's going to suck in. If she were going to puff, she would puff out her cheeks. So it depends on if someone can sip or puff their selection. So the timing switch here is actually doing the scanning for her. So it will scan through the options on the iPad where she probably has a text to speech option or a program that she's scanning for icons so she can access the technology on the iPad. So as it goes through the options, very much like this woman's screen is, she will, instead of press a button, sip when it gets to the option she's interested in. And the mounting situation is very interesting here. So she has a table mount to hold the iPad, and then she has a clamp mount to hold the sip switch. So there's lots of different switches that you can use, but these are just some examples of two that are pretty cool. So what is the ALS Association's Equipment Loan Program, or ELP? It's a library where we house AAC and AT devices that are available to loan out to individuals living with ALS, and it's free of charge. So we have a few requirements that we ask. We ask that the individuals have a diagnosis of ALS and that you sign an agreement waiver form that you can get from your regional program manager. It's, again, free of charge. We also ask that you register with our chapter. If you want to register with the national chapter, that's fine, but it's going to be specific to the state of Florida. And then when you're ready, you can either send a request to your RPM, your regional program manager, or you can have a speech language pathologist fill out the online app. And I wrote the steps out here for you. So this is the website, which you can click on, and then we'll go to local care services, the equipment loan program, but it's actually labeled out equipment loan program, ELP. Then it's the loaner communication device application. And down here on the bottom right corner is actually what it looks like when you've arrived to the right page. So the reason why we ask an SLP fill out this application is because should you require training, they can do it for you. It's part of their scope of practice, so they should be able to do it. And if you have some difficulty, just let us know and we'll be happy to help you. So a lot of times I get asked what's in the ELP. So actually all of these items we have in the ELP. Whether they're available or not, I go and look, and then I will ship them out to you via FedEx, excuse me. But it is based on a first come, first served basis. If you have insurance, we ask that you do use insurance first, just because we have limited resources and we want to make sure that everybody has an opportunity to communicate and access technology to the best of their ability. And also, if you have insurance, insurance is going to pay for a personalized device for you that fits your needs. Kind of the sad part about the library, although we're very, very grateful, is that the library has a limited amount of items, but it's very specific. So if I have one item, it may not exactly match your needs. We're more than happy to loan it out to you for as long as you need. But if you could get one for free that your insurance is going to pay for and it's going to be specific to you, we definitely want you to use that one because it's going to match you best. But again, happy to help, happy to send you anything you like. And if we don't have it available, we're happy to put you on a waiting list. Also, if you have applied for insurance and they put you on a, wait, like a 6-month wait, or you got denied, again, we're happy to send you out anything you need. So again, we have the switches. This top right-hand corner is a Megabee. We have mounts galore, keyboards, voice amplifiers, Surface Pros. Unfortunately, they're all checked out right now. I just sent one out. We have Tobii speech generating devices, and we have plenty of resources that are free that we're able to send out, like communication boards, handheld e-tram boards that you guys keep forever. It's yours. So the last question is, what can I do about my speech or voice right now? There's voice banking, so voice preservation methods. You have voice banking, so that's where you would record your voice as it is now into a microphone, and it's through acapella or Model Talker. These services right now through Team Gleason are supporting the payment for those methods, and then they also right now are also paying for the microphone needed to record those messages. So depending upon which software program you decide to use, again, it's totally up to you with Team Gleason, and these are not insurance covered, so it would be a cost to you. I'm not entirely, I believe Model Talker is $100 acapella. I know the full cost one is pretty expensive, but again, Team Gleason is offering a program where they will do this for you for free. Great organization as well. We work in tandem with them. But you would record your voice. The Model Talker and acapella would give you sentences to say to create your voice. And they're going to give you some kind of funny sentences to say, but the purpose behind it is to record specific sounds in that sentence so they can create that synthetic voice. Now your voice will be synthetic. It will be like a Siri, but you. So it'll be a little computerized. And obviously, the more sentences you record, the better quality voice. And then it can literally be just like the voice talking out of the speech generating device. Now people ask, can I upload this to the speech generating device? And the answer is yes. Yes, you can. They have an app that is downloadable on Windows operating systems, and all the Medicare funded speech generating devices run on Windows operating systems, so you're good. Message banking. This is where an individual will record personalized messages using a voice recorder in their natural speech at that point. So that is a personalized journey where it's also called legacy banking, but that is where you record personalized messages to your loved ones. So I typically tell people, carry the voice recorder around with you, because you're going to say phrases that are specifically unique to you that a speech generating device can't capture. They're really not able to do prosody or intonation or cadence like you can. So if you have a specific phrase like, oh my goodness, the speech generating device can't mimic that. It would come out, oh my goodness. Instead of, oh my goodness, it's just not going to have that same you to it. So if you wanted to do that, message banking would be the route for you. And then dysarthria strategies and voice amplification. Voice amplification is not something you want to do with dysarthria. I'm just clarifying that before I start. Dysarthria strategies, we have a handout in which there are some strategies an individual can use who still is wanting to use their voice as much as possible, but they aren't quite sure how to do that. So I'm happy to send that handout to you. It's where you could, use a text-to-speech app to say one word, like a topic, if you will, to kind of give the conversation a direction. So if you wanted to know what's for dinner, and instead of saying what's for dinner and your communication partner really can't understand you, you could just type out dinner on your text-to-speech app. Or if you wanted to know what's going on with one of your friends and say your friend's name is Sally, and you keep on asking your communication partner, what's going on with Sally, and they can't hear you after 2 tries, I say after 2 tries, go to a different strategy, and you could just say Sally ? And send it in the text-to-speech app. And then they'll be like, oh, what's going on with Sally? I'll tell you. So that's some of the strategies, sitting upright to get good breath support, looking face to face, making sure they can see your mouth. These are all types of strategies that can really help. and clarifying your speech without you having to do a lot. For voice amplification through voice amplifiers, you want to make sure when you're using a voice amplifier, you're amplifying clear and concise speech. So those are more for individuals who are losing a little bit of volume due to some respiration issues. So you definitely want to talk to a speech language pathologist before you go that route. And we also have this voice preservation handout that I'm happy to email you, where it details everything and the voice and message banking process and how you can do either one or both. But typically, if people are going to do both, I highly encourage them to do voice banking first, because it's really persnickety about the vocal quality, and message banking will take your voice as is. So with that, I am done with the presentation. I might have gone over a little bit with the 20 minutes, and I sincerely apologize. This obviously you cannot do now, but please feel free to email me any questions you may have. My email address is atprograms, so ATPROGRAMS @ALSAFL.org. Thank you so much. Have a great day.